Let's learn more about the risk involved in breastfeeding. As we are talking about the benefits associated with breastfeeding, we can also talk about the many potential risks that are related to breastfeeding. Although the benefits are numerous, there are also some potential risks and challenges that may come along the line in the journey of breastfeeding. Number one of the risks is sore of the nipple. We call it nipple soreness or pain in the nipple. This comes as a result of improper attachment when the child, instead of the whole areola entering the baby's mouth, the baby tends to use the gum to be pressing on the nipple. You see that you feel the pain on the nipple, there will be sore of the nipple. So we always advise that the child should breastfeed well by making sure that the nipple and the whole areola enters the child's mouth. So if that is not done, if that proper attachment is not done, you say the child will be pressing on the nipple or will be using the gum to be pressing on the nipple, and you will feel pain, and how do you call it? There will be sore of the nipple. The second risk factor or challenge associated with breastfeeding is breast engorgement. You see that when the breast is overfilled with the breast milk, it becomes enlarged, it becomes engorged, it becomes very tender, and it comes with pain. You see that the ducts and the tubes and the lobes of the breast are filled already. So when it is not sucked for some time, you see that the mother will feel discomfort, will feel pain. There's that kind of tenderness. When you touch, the person feels pain. Even when they are wearing their bra, they feel very uh, too much pain because of the engorgement. So engorgement of the breast is also a risk factor associated with breastfeeding. Point number three, there is something we called mastitis. Mastitis. Mastitis is the inflammation of the breast tissues, which is caused by poor milk drainage or bacteria. So, as my previous point is, when the breast gets engorged, it ends up being inflamed. It ends up being inflamed. You see that the tissues of the breast becomes inflamed. That's what we call mastitis. And this can be caused by two factors. Number one is either bacteria or to poor drainage. So when you are breastfeeding and you don't allow your child to drain the breast milk or drain the breast of the breast milk, if the child doesn't drain or suck all the produced breast milk stored in the tubes in the duct, it ends up the tissue to become inflamed, and that's what we call mastitis. So inflammation of the breast tissues. So sometimes somebody will tell that my breast, I've got an inflamed breast, or there's an inflammation of my breast, either the left or the right. That's mastitis, and it's one of the risks or one of the potential risks associated with breastfeeding. And this one is caused by either bacteria or poor drainage. Breast abscess, a painful infected pocket of pus in the breast tissue. So as the breast gets inflamed, you will see that there will be an abscess formed. We say a pus will be formed in the tissues, whitish fluid. That's what, like, you see that because of the inflammation, there will be pus formed. Some whitish fluid will form in the tissues because it's already swollen. So pus will be formed there, and abscess will be formed. So it's very hard and very passive. When you press, you see that there will be some pus, whitish fluid coming out of the breast. So the ducts, when we talk about the duct are the tubes or the vessels, or let's say the means through which breast milk travels. So the duct will be blocked or plugged. You see that because of the mastitis or because of the poor drainage, you realize that the duct will be blocked. And if this one happens, you realize that there will be an inflammation and pain. Another risk factor we can talk about is breastfeeding and medication. Breastfeeding and medication. Certain medications can pass into the breast milk, potentially harming the body. So one of the risk factors that we should consider is breastfeeding and medication. There are some medications that can pass through the breast milk. After taking those medicines, when absorbed into the system, it can go to the bloodstream, go into the breast milk, and pass through the breast milk to the child. So we have to be very careful when we are breastfeeding. Some drugs that we take, when we say these drugs are not for breastfeeding mothers, please abide by the rules and regulations and observe cautions and precautions of medicines, because some drugs can pass through the barriers and will be found in the breast milk when you are breastfeeding. One of the risk factors include oversupply or undersupply. When you say oversupply, there are some breastfeeding mothers who tend to overproduce their breast milk to the extent that it becomes worrisome. We call it oversupply. And there are others too who tend to lack the supply. They hardly supply or produce the breast milk. So one of the risk factors that you might come across include oversupply or undersupply in breast milk production. So you should be mindful that in the case of or in the journey of breastfeeding, you can undersupply or you may oversupply. You can undersupply or you may oversupply. And lastly, breastfeeding and surgery. What we are saying is that previous breast surgery can impact milk production or breastfeeding. So if you've had surgery or if you had breast surgery before, if you ever had breast surgery, it can negatively affect your production of milk or breastfeeding journey. Thank you very much for joining us for this episode. Stay tuned, like, comment, and share this video for us. Thank you very much.